The world's largest coronavirus vaccination program is underway in India. The government hopes to inoculate 300 million of its population by July. Former senior associate editor for the Tribune in India, Prasad Kunduri, joins us now from New Delhi. Thank you very much for your time. Here in South Africa, we're struggling to procure and secure enough doses. Presumably no such problem in India, given that the India Serum Institute is working in close partnership with the AstraZeneca vaccine. What is your rollout schedule looking like?
Well, as you just said it, the government of India rolled out its most ambitious program this morning and closed it at 5 o'clock against the target of 300,000 people to be inoculated on day one. As we speak, the health ministry officials are briefing the media as just now. And the figures that are available as of now show that some 165,000 people took the shots today. So that is where it stands. So over the next few days, they want to roll out. The first phase plans to have 300,000 people, the frontline workers, which includes doctors, medical professionals, sanitation workers, somebody who have been exposed to the coronavirus handling and the pandemic. It's certainly the day one, and the initial figures show where we are. Certainly, the drug doses are available. Some 10 million doses from AstraZeneca Serum Institute have been procured by the government of India, and another 55 lakh of the local produced, indigenously manufactured from Bharat Biotech. But we don't know yet if there are any figure in the breakups, but that's where we are.
It's certainly a very ambitious program. How is the rollout going to work practically on the ground with so many people to try and vaccinate each day to reach that number of 300 million by July? Are community health structures in place to get this done? Yeah,
the government has elaborately mapped the country district by district, and they're using the model replicating it from the Election Commission of India's exercise in its conducts of the elections in the country. And if you know, India in the last elections that we had for the general elections of which elected the Lok Sabha in 2019, we had an estimated electoral of 600 million people. So if the first phase is 300 million is a target by July, as you had also mentioned in the bulletin. Give some inputs as you go along if there's any tweaking that needs to be done. But previously in your program last week, they have had 2 national dry runs, several state runs. Plug the gap. I think all the data plus today's rollout and as we go in the week should help the government to come up with if the plan needs further strengthening.
Our signal isn't great, but I want to try and ask you one more question, if I can. We know India has been very hard hit by the coronavirus, and this vaccine will come as a great relief for frontline healthcare workers. What are your daily case numbers looking like at the moment?
Well, for the last few days, the trajectory has flattened. That's what here. It's the active cases are less than 2% is what we are recording. About 10 million people were affected, but over the last few weeks, few days in particular, the cases have fallen sharply, except for 1 or 2 states where the spike was there. But by and large, it seems to be under control. That's what is one heartening feature of this entire exercise as we roll out the vaccine today.
Certainly good news that the numbers of new cases are decreasing. How is the healthcare system coping with the number of hospitalizations at the present time?
Well, right since the day of lockdown, there has been an elaborate process in place, district by district, state by state, and constant monitoring at the highest level, at the state level. So those numbers have really been there, but in fact, in the last few days, we have seen requests from various state governments to denotify COVID-specific hospitals, also to release some health. So that is one area which shows that the number of cases which require critical care are coming down. And the government has also requested the health authorities to kind of see that when you release the beds for other things. In fact, another point that I need to clarify or bring on to the table is in this vaccination program, the government is which is for routine immunization for other health, which is the routine immunization that has been going on for other healthcare sectors. So this is how it looks like here today.
Thank you very much for that update from India. We were speaking to Prasad Kunduri there. He is the former senior associate editor for the Tribune in India.